Hello and welcome. Today we're diving into a lung condition known as cryptogenic organizing pneumonia, or COPE. This relatively uncommon illness can be quite serious, so let's explore what it is, how it develops, and what can be done about it. The term cryptogenic literally means of unknown origin. In the case of COPE, that means we don't definitively know what causes it. Unlike typical pneumonia caused by infections, COPE isn't linked to bacteria or viruses. Instead, it's believed to be an abnormal healing response to some form of lung injury. Possible triggers include certain viral infections, medications, and even autoimmune diseases. However, in many cases, the initial trigger remains a mystery. Now, let's talk about what happens inside the lungs with COPE. The defining feature is organizing pneumonia. This refers to the inflammation and scarring that occurs in the small airways, called bronchioles, and the air sacs, called alveoli. The body attempts to repair this damage, but instead of normal healing, excessive tissue and connective tissue, or scar tissue, fill the air spaces. This blockage makes it difficult for oxygen to pass into the bloodstream, leading to breathing difficulties. COPE is considered a rare disease. While the exact prevalence and incidence are not fully known, studies estimate that it affects only a small number of individuals per million people each year. It can affect people of all ages, though it's most commonly diagnosed in individuals between 40 and 60 years old. There doesn't seem to be a strong predisposition based on gender or ethnicity. The symptoms of COPE can vary from person to person, and they often develop gradually over weeks or months. The most common symptom is a persistent dry cough. Patients may also experience shortness of breath, especially with exertion. Other potential symptoms include fatigue, fever, and unintentional weight loss. In some cases, the symptoms may be mistaken for other respiratory illnesses, making diagnosis challenging. Diagnosing COPE typically involves a combination of medical history, physical examination, imaging studies, and sometimes a lung biopsy. A chest X-ray or CT scan can reveal characteristic patterns of inflammation and scarring in the lungs. However, imaging alone is not enough to confirm the diagnosis. Often a lung biopsy is needed to examine lung tissue under a microscope and rule out other possible conditions. While COPE doesn't have definitive subtypes, it can be categorized based on its association with other conditions. For example, it may be classified as primary COPE when it occurs without any known underlying cause, or it may be secondary COPE when it is linked to another condition, such as a medication or autoimmune disease. Understanding whether the COPE is primary or secondary is important for guiding treatment. The primary treatment for COPE is corticosteroids, such as prednisone. These medications help to suppress the inflammation in the lungs. The treatment course typically involves high doses of corticosteroids initially, followed by a gradual tapering of the dose over several months to years. While corticosteroids are effective for most patients, some may require other immunosuppressant medications if they don't respond adequately to corticosteroids alone. In some cases, a lung transplant may be necessary. Unfortunately, since we don't fully understand the causes of COPE, there are no specific prevention strategies. However, avoiding potential triggers, such as smoking and exposure to environmental toxins, may help to reduce the risk. Maintaining a healthy lifestyle and promptly addressing any underlying medical conditions may also be beneficial. The prognosis for COPE is generally good, especially with early diagnosis and treatment. Most patients respond well to corticosteroids and experience significant improvement in their symptoms. However, relapse is possible even after successful treatment. Ongoing monitoring by a pulmonologist is essential to detect and manage any recurrence of the disease. Research continues to explore the underlying mechanisms of COPE and to identify novel therapeutic targets. Studies are also investigating the potential role of biomarkers in predicting treatment response and identifying patients at risk for relapse. With continued research and advancements in treatment, the outlook for individuals with COPE continues to improve.